A very good afternoon to you. My name is Mark Drax. I'm speaking on behalf of SASH, and it is my great pleasure today to welcome Erica Sarr. Erica, a warm welcome from the warm climes of the Meadows.
Hello, how's it going?
It's going great. Probably a little cooler over here in England than where you are, but I hope at least you're not burning like they are in California.
No, we're doing well.
Erica, it's lovely to meet with you here in cyberspace this afternoon. We sent you a few questions based on the fact you are going to be presenting at our upcoming conference. So huge thanks for that.
Of course, I'm always excited.
Well, the title of your talk is a quote, "A Mind of Its Own, Understanding, Treating, and Grieving Erectile Dysfunction in Therapy." So I'm going to kick off with a few questions here. And the first question is, I've read the title. What's your inspiration behind your title? And tell me more about it.
Well, I mean, the theme for SASH this year was kind of, nobody taught me that, like adult sex education kind of stuff. And I always like to be expanding my learning. And so I look for a topic that has been afflicting my patients that I don't know as much about as I would like. And I try to become as expert in that as I can be and then pass that on to other people, because I kind of have the luxury of having a little bit of space to do that. And so one thing that shows up in treatment, because I treat only men, is a lot of challenges with erectile functioning. Some people have erectile problems because of medical conditions like cancer. Some people experience natural changes in function because of aging. But even more challenging for people sometimes are people who have like what I guess we would call psychogenic erectile dysfunction, where the plumbing all works. They've been to doctors, but for reasons of trauma or compulsive or addictive pornography use or whatever, obsessive compulsiveness, anxiety, they're really not experiencing functioning like kind of the machinery says they should be able to. And so much of media and culture tells men that like their worth and their masculinity and their sexuality is tied up in having an erection, and so if that's not working for people the way that they want or the way that it used to, they can experience just tons of shame and trauma and anger, and it really affects them pretty profoundly. So,
Erica, when you talk about these psychological challenges that could cause this dysfunction, would I be accurate in describing this loosely by saying basically your mind is not on the job because it's elsewhere? Would that be accurate?
Yeah, in part. Elsewhere could be, not able to connect. So if we're thinking about like porn-induced erectile dysfunction and things like that, we've kind of trained our arousal response to something different than what's happening in actual physical real world sex. So that's one thing. But yeah, if somebody is in trauma and their brain is kind of back in that place of trauma and saying like, okay, I should be able to get excited, but I remember what it was like when it wasn't consensual for me, and I'm full of all these fears and anxieties. Even if my partner looks or feels or sounds nothing like my abuser, they're conflicted. They're like, well, what's wrong? Why can't I be with them if this is not the same situation? So yeah, the brain's kind of off doing its own thing willingly or unwillingly, and it's not present.
Beautiful, thank you. That's a very clear understanding. Out of curiosity, so the topic itself, how would you say this is important to sexual health? Because of course SASH stands for the Society for the Advancement of Sexual Health. So how would you see this topic being of relevance to sexual health?
Well, I think that, people often, the old definition of sexual health used to just be, is the plumbing working?
Yes.
And if you're free of what defect or disease, the old medical model, then you're healthy. But if you're not able to have the sexual function that you want, if you're filled with anxiety about it, or if you're filled with grief about it, like say in the example of just, normative aging, I think helping people understand that sexuality changes across the lifespan is part of our mission of helping people understand sexual health, I think normalizing talking about problems with sexual functioning and taking them out of the realm of shame and out of the realm of secrecy and saying, yeah, sometimes things don't go well, you know, in media and, you know, in movies and in porn and everything. Like, everybody orgasms at the same time. It's always perfect. Everybody has perfect genitals. And nobody talks about, like, what do you do if you're, you know, if your body isn't functioning the way that you would like, without feeling like it must be something about you, that you're defective in some way. And really, that's always been my biggest goal, is to help people have like joyful and creative and spiritual and connected sexual relationships, whether it's solo sexuality or partnered sexuality. So I hope that answers the question.
It does very much. And would you say this is probably a much more widespread problem than is commonly recognized, because people are too shy to talk about it?
Absolutely. Like, we know just in general, men are not as likely to report any kind of sexual problems, because societally we've tied that so much up with their identity and their masculinity and things like that. And so we know, like, in cases of sexual abuse and things like that, sometimes they won't bring that stuff up. So when you're trying to find causality for a problem, you know, they'll go to their doctor, maybe try to get a pill, you know, to kind of manage it. But if they're not talking about that they're full of fear or regret or shame or whatever, some of the underlying stuff is just going to stay stuck there. And some people, you're right, probably aren't even going to their doctor and are just sort of trying to tough it out, or not pursuing the relationships they would otherwise.
And correct me if I'm wrong, that tragically, of course, that can then lead to some men taking it out on their partners if they feel in any way ridiculed or as you said, not masculine enough. And this, of course, is one of the reasons because I also, like you, treat men only. And I don't have I'm a coach, not a therapist like yourself, but you're a doctor and you're a little more qualified than me. But certainly I've noticed how when men struggle with an issue, they can tend to take it out on someone, and it's usually the wife or the partner, which is tragic.
Yeah, I mean, it can come out a whole bunch of ways. There can be that blaming thing. If you would take better care of yourself, maybe I'd be more aroused by you. You know, maybe if I, you know, that old terrible joke, you know, maybe if I find somebody younger and that's what's going to arouse me, because we know, like, humans, not just men, but humans are aroused by novelty. So of course there's going to be like an extra charge if I just go get a new partner, and then we think that's a solution. If maybe that's a one-time solution, like, oh, I was able to get an erection in this crazy situation. Like, well, intensity isn't the same as pleasure. Intensity isn't the same as love. Intensity isn't the same as attraction even. And just because you had a intense or fear response doesn't mean that that can be the ongoing solution. But absolutely, people can, in their shame, right? Because shame is so toxic to feel. And particularly men are socialized that anger is the only really acceptable emotion in a lot of ways. And so that all gets kind of funneled into anger, and they can lash out at themselves, they can lash out at their partners. And yeah, and then it becomes really corrosive to the relationship, because then they don't want to initiate and the partners don't want to initiate, and the divide gets further and further apart.
No, Erica, thank you. That's I haven't struggled with erectile dysfunction, but I've struggled with many issues in my life following trauma as a child, where I have sadly lashed out, thank God, always verbally, but in relationships in many years gone by. So I'm relating to that very strongly. So thank you for that.
Sure.
Erica, what a couple of things, notable things you would like participants to take away from your presentation this year?
Well, I think one of the biggest things, because it's a conference largely for therapists, is that there's something we can do to help, right? Mm-hmm. So many people want to put particularly like functional problems in the realm of medicine. And certainly medicine can help. When somebody comes to me and they're like, I have erectile problems, I'm like, have you seen a doctor? So let's first make sure that it's not related to cancer. Let's not, if there is a medical causality, let's have it looked at. But that being said, there's lots that we can do. And even if it's not restoring function, there's stuff that we can do just to be there with people. So like, that's why I added like the grieving part. So if someone, for example, has had prostate cancer, or even just like I said, natural aging. Oops, my camera's slipping there. So sorry.
Right.
Make sure
Still
I don't disappear off the screen for you there. Um, even if they have, like I said, it's a medical causality or even natural aging, it is a change. It is a loss, right? We're not who we were. And to pretend otherwise can feel really crazy making for people. Like, I'm going to keep pretending that I'm 20 years old. No, you're not. And that's okay. You know, we overvalue youth in a lot of ways in our society. And we don't say, like, you can still have a sexual kind of life in your 60s, 70s, 80s, 90s. It may not be the same kind of penetrative sex life that you had. It might be, I don't know. But if it isn't, let's talk about, let's not just see like, oh, that's the way it was. Let's acknowledge that there's some sadness that comes with that, and that's okay. And so that's the realm of therapists. That's unfortunately something that medical doctors don't get trained in as well. And so my hope is if there are medical professionals or nurses or physicians or psychiatrists who come, they can take that away to their medical practice too. So that it can not just be like, well, here's the mechanical bit, here's some pills, sorry for your loss. I mean, that's a very cold representation of medical people, but we know that they often don't get very comprehensive sexuality education, and they don't know how to deal with those problems with their patients a lot of times. So
thank you.
I think that's my biggest wish.
Brilliant. And I'm sure there'll be others on the day. Thank you. Erica, you've presented at SASH before, as I said at the beginning. Anything particular that you spotted that excites you about the conference this year?
Well, I think I'm excited to see how we handle the online format. I miss seeing everybody. Going to these conferences is like one of my favorite things because so many of my dear friends are in the organization. And so we won't be able to get up to as much rowdy trouble as we like to. But I think that, as time has gone on, people are getting really, really good at this presentation thing. And one exciting thing is it might provide an opportunity for people who couldn't otherwise make it to the conference to join. I certainly have thrown the conference out to some of my colleagues that I went to my doctoral program. They're like, I'm looking for some CEs. I was like, this is an awesome organization and I'm speaking and you should come. And so I know other conferences I've either taught at or attended this year, I've got to meet people from all over the world who wouldn't normally attend the conference. And so rather than just getting to see the people I like to see, maybe I'll get to meet some new ones.
Oh, look, bless you for that and bless you for your support for the conference. That's fantastic.
Of course.
Funny enough, that actually ties in quite nicely to my last question for you, which is about this crazy virtual world. Everyone sees it, a lot of people have seen it as a negative that we've moved forced online. But I'm going to ask you a question which is from the other side of the coin. Sure. What benefits do you feel you have derived either in your private life, well, not necessarily private, but your life through at the Meadows, your working life, or how it's maybe helped your clients? What are some of the benefits of being forced online that you found?
Well, I actually just gave a talk on the effects of technology on sexuality. And one big thing for me is it's made me kind of confront how kind of techno rigid I was getting. I was like, here's how far I've developed and I'm going to stop. I think that's good enough. That wasn't a conscious decision. I thought of myself as a pretty like techno liberal kind of person, but I realized, the more young people that we were getting in treatment, or the more families who, because of, the world situation, couldn't come and visit and things like that. And they're like, well, how are we going to stay connected? And I was like, ooh, yeah, we don't have some of the resources of connectivity that we've become accustomed to, i.e. being 100% connected, which has some big drawbacks, but also has some big positives, and that people were really suffering with that kind of lack of connection in some ways. And so we've really done our best to amp that up, and we're kind of considering different opportunities to enhance that in our programming. That's certainly a steep learning curve for us. For me, I'm I'm really excited about mentoring people and supervising people. It's something I think I enjoy and I tend to be pretty good at. And so for me, I'm trying to move into some of that. And I'm realizing that people getting more and more comfortable with the online platform expands my possibilities of being able to do that for people, you know, to be able to consult for people and help them out in a much broader geographical range than maybe I could have in the past. And I think it's really gonna test how we adapt intimately to technologically mediated relationships, which can really open up a host of opportunities of accessibility of therapy. You know, and that's really, you know, we have kind of an ethical duty to provide to people as much as we can. And so if we can start to really suss out the pros and cons of true kind of digitally mediated therapy and say like, all right, what are the risks that we need to manage and what are the benefits, then we might be able to provide therapy to more people in a place that feels safe to them because they're in their home and maybe they can be more open and they can be more trusting rather than people who might have limitations of, you know, transport and mobility and accessibility and things like that. So
Okay, I love that positive spin. I completely concur and agree with you. Obviously, I've been talking to a fair few people through the last several months using Zoom, FaceTime, whatever. And I've actually enjoyed the ability to reach people who would otherwise might struggle to get in to see me or whatever. I do miss, obviously, I've spoken at a couple of conferences. I miss, like you, the hugs and the socializing aspect of it. But I think technology definitely is here to stay, and this is kind of fast-tracked and so bold and commonsensical, I feel, of you to accept. And thank you for saying you accept. You actually had stuff to learn. I think we all do. And so very sadly, Erica appears to have disappeared. I can only guess her internet system failed her, which is a great shame. We had actually enjoyed the last question. So I'm going to sign off on behalf of us both. I'd like to thank Dr. Erica Sarr for her time and say how much I'm looking forward to listening to her online presentation at our conference in just a few weeks, starting on the 15th of October. Thank you, Erica, so much. This is Mark Drax signing off for SASH. See you next time.